Our next speaker is Elisabeth Benjamin. She is Vice President of Health Initiatives Community Service Society and is one of the most knowledgeable people on healthcare and health insurance issues and Medicaid and all sorts of things like that. She's a strong friend of Balcony and works with Peter Slocum at the American Cancer Society on their healthcare initiative. Elisabeth, please give us a perspective on the uninsured.
I just want to thank Lou and Balcony for this incredible convening. It's really exciting to be here today in this illustrious place. The last time I was in a Hard Rock Cafe was 1976, so it's a little embarrassing that it's been this long, but what are you going to do?
And you remember it from 1976.
I was 14, so and it was
I don't remember 1976.
big deal. So I want to talk about really quickly what's in it for uninsured people. The bill is extraordinary. In New York, we have 2.7 million folks who are uninsured. Most people think it's about 1 million people who would get covered under the new law, which is really an amazing thing in of itself. Of those 2 million who will get covered, about 1 million will be going into Medicaid. We already have a very expansive Medicaid program, so they're all really basically eligible for Medicaid, but they will be able to migrate in. And that's really good because of the mandate that will be sort of forced in, and folks who have been eligible all along but not enrolled will get covered. And in return for that, New York State will get roughly $30 billion over 10 years to pay for this for the enhancement in Medicaid, and that's an extraordinary thing. The Nebraska deal is dead. We are being treated like every other state in this regard, and that's a wonderful, wonderful thing for New York. The other 1 million people will be going into the exchange in some way or the other, and to support folks being able to go in the exchange, New York will get $25 billion over 10 years, another significant chunk of money. So why is that so good? Why are we so excited about this? I just want to say, and with all due respect to Mr. MVP, I sort of disagree with, I think, everything he said, except we should go back to hospital rate setting, but which we do agree with.
I'll just
but,
take that.
but basically, right now, we're on this trajectory that's completely untenable. Insurance costs in the last 10 years have gone up 92%, median wages have gone up 14%. You know, enough is enough. If we had done nothing, another 522,000 people would have been uninsured in New York. 1.2 million people would have dropped job-based coverage. So we had to do something. And spending would have gone up by 11%. On the open market today, the latest numbers from the Department of Insurance, individuals, if you just go out and try to buy insurance on your own, are asked to spend $1,000 per member per month for an individual. Family coverage is $24,000. To give you a sense of what that means to a family of three at 300% of poverty, around $67,000 a year for a family of 3, 2 adults, 1 kid, would be asked to spend 41% of their gross family income on health coverage. It's not doable. So that's why we need these subsidies, because insurance is so expensive. Now we know from Massachusetts, the only place that's really tried this experiment, that once you put folks into the system, and the penalties in Massachusetts are very similar to the ones that are in the federal law, we know insurance costs will go down by 30%. Why? More people are in the system. Right now, we only have 31,000 people left in individual purchasing coverage on their own. So more and more people have gotten uninsured, more and more people have dropped this individual coverage or job-based coverage. So it's really, really important to have the mandate, as much as those of us who are civil libertarians or Tea Partiers or whatever might not like a mandate. It's really important to have everybody in the system so we have a sort of functional, regularized system of thinking about coverage. One of the things that we'll start right away that's really exciting is we are going to be setting up a high-risk pool in New York State, we hope, if we get a permission from the Secretary, and that will be for people that are currently uninsured that have very high medical needs. So something's happening for those folks out of the block, along with a bunch of insurance regulations that Troy had discussed. The other thing I wanted to say is, with great, great love and respect for Lorraine, actually this bill isn't just for Americans. New York has long provided Medicaid coverage to immigrants, all lawful immigrants, and people that are in the process for applying. And under this bill, folks, at least for Medicaid, will still have those same rules applied to them because of as a result of court cases. So for the very, for people really below 133%, we do have something for immigrants that are sort of anywhere in the legalization process. They have no waiting periods, nothing like that. That is still an issue for the rest of the country. For the truly undocumented, we are so grateful that we have Luray and the public hospital system in New York City to help us, and we will all be fighting for more resources for them to do what they do so well. But I always, when I hear American, I always get, no. So please forgive me for, please forgive me for making that distinction. But I think it's an important one for us to know in New York, is that we really have stepped up and done the right thing for immigrants in New York. And I'm going to stop there. And I want to thank everybody for letting me be here today. Thank you.